Hi, good afternoon. My name is Dr. Jay Desai, a holistic optometrist in Route 22 in Milltown Road, and I'm here to provide you excellent eye care because I'm looking out after your eye health. Now, what I'm going to talk to you today is why contact lenses are and they must be treated as a medical device rather than a profit-making devices for some unscrupulous doctors. Well, look at my wallet, empty, because I paid an arm and a leg for my contacts at a nearby optical store. We do it differently. We treat your lenses as a medical device, and what they do is, in order to wear lenses successfully, we must do a pre-fitting test for new patients or existing patients, and then we also do a fit and a follow, both for refits for someone who has worn an existing lens but they're not satisfied, or a brand new patient. Now you ask me, Dr. Desai, why do I need to go have multiple trips when I can just go to a schlock optical store nearby and they just give me a lens and say call me when it's fine, we can order for you. Number one, did your optometrist talk to you about allergies, do testing for dry eyes because they can affect your lens? Let me explain what I do, and Dr. Ross also. Number one, seasonal allergies, depending on the intensity, can actually affect your lens comfort, because when underneath the eyelid gets inflamed, it coats your lenses with protein and mucus discharge. And so when the lenses get coated up, guess what? You're going to see blurry. It just feels like you want to take it off. Now you can ask, how do I know if allergies are affecting my eyes? Important. This cotton swab, painless, just a little wee bit pinch. I look underneath the eyelids. If it's healthy, it's a smooth, like peanut butter. While if it's inflamed, it has a texture of a chunky peanut butter with little bumps here and there. Now, the important question is, how intense is your allergies? If your allergies are pretty mild, tolerable, what's important as part of your follow-up and your pre-testing is you prescribe a hydrogen peroxide-based cleaning solution. What this does, it's the most powerful cleaning agent to keep your lenses clean of protein and deposits, which unfortunately many of the no-rub solutions will not completely clean. And for many patients, switching to this solution makes a world of a difference. But let's say, bloody allergies flaring up galore, but you played baseball in the summer, or sports, and you cannot tolerate wearing glasses. He goes, help me, what do I do? I can do this for you. We have a one-day disposable lens. The beauty is you just wear them as needed, so if you're going to use it for sports, going out, meeting friends for a party, just pop them in. And then when you are done, toss them out. For the vast majority, they experience good comfort. Now the second question you must ask is, if you had a contact lens fitting done elsewhere before, have you been evaluated for dry eyes? If you ask why it's important, remember, contacts sit on your cornea. If you have pre-existing dry eyes, guess what? It's going to, like the IRS, it's going to suck everything out of you, including the water of your lenses, and guess what? It's going to stick to your cornea like this, and guess what? You're going to be left uncomfortable. You're going to have an increased risk of eye infections. So what do? If you have pre-existing dry eyes, I must need to be evaluated. And then he goes, how do I know if I have dry eyes or have a risk? You need to have this test done. It's a little fluorescein strip, quite painless. I quickly just touch your eye, look at the tear film, and by measuring how long the tear stays on your eyes before it gets dry, it tells me, number one, if you have pre-existing dry eyes or if it's normal. Now, you must ask yourself, I have dry eyes, now what do I do? Well, this is where I come into play, looking out for you. Number one, many medical conditions can cause dry eyes, like, ah! My arthritis is flaring up. Well, you know what? Arthritis causes your eyes to get dry. Being an autoimmune disease, it attacks the lacrimal gland, which makes the tears. And he goes, yes, I have arthritis, but I'd like to wear contacts. What can you help me? That's what I'm here for. Fish oil, 1 teaspoon a day. It may take 2 to 3 weeks to work, but personally I and Dr. Ross have seen it help make natural tears much better, so you can wear lenses more successfully, because the fish oil has natural anti-inflammatory properties, and it's been scientifically proven to help with dry eyes caused by autoimmune disease. Now, the other thing for all you guys who like to eat McDonald's or processed food, unfortunately, when you have a deficiency in omega-3s, it can also cause your eyes to get dry. For example, if you're young, you don't have arthritis, but if your eyelids gets a little bit inflamed, called meibomitis. If you ask what meibomitis is, right by the eyelash base, there's a gland that makes the oil, and the oil protects the tears from drying up quickly. But when it's clogged up, it looks like looking at a tip of a cheese whiz if someone squeezed a little bit of cheese out. But unfortunately it does not taste like cheddar. What it does, I've seen it happen, that if it gets clogged up, patients will have dry eyes. Sometimes the cornea, the clear part of the eye, gets a little irritated. And so how would I treat it? Good question. A different omega-3 fatty acid called flaxseed oil, 1 tablespoon a day. I have seen it work too, and it actually helps clear up the glands and makes the meibomian glands work better. Again, 2 to 3 weeks, and guess what? With this therapy, if you're compliant, you're going to be wearing your lenses more successfully. Now you're going to ask, okay, I've been wearing lenses before, why do I need a follow-up? Good question. How your lenses sit on your eye after 10 minutes in the exam versus 8 to 10 hours outside makes a world of a difference. For example, the lenses may fit great, but once you wear them all day, if your lenses get a little bit tight, it can actually increase the risk of eye infections. And so what I do on your follow-up visit, I make sure the lenses still fit properly. Again, I look at the cornea with this little diet if as needed, and if I see any irritation from the tight lens, I'm going to refit you so you can wear them healthfully, successfully. Now, finally, for someone who's in college and they have a rigorous working schedule of which they work hard, they study all day, files coming up, and sleep with their lenses. One thing, be aware, we run a big risk of eye infections. So, if you're a college student, and if you're a good student, not drinking up at the frat house like I used to do, but you're studying hard to get straight A's, and you sleep with the lenses, or you wear them 15-16 hours a day, we may consider some silicone hydrogel materials. Some of these lenses have been approved by the Food and Drug Administration to wear up to 30 nights in a row. While I really do not encourage you to sleep with the lenses up to 30 days, at least with the proper fit and a follow-up visit, I just want to ensure that these lenses are safe and you don't have any complications. So please remember, from your previous contacts, if you ever had a red eye from improper fitting lens, please see the side.